Erectile dysfunction is a topic that many of us might feel uncomfortable discussing, but it's a common concern that affects millions of men worldwide, especially as we age. Today, we're going to have an open and honest conversation about this important aspect of men's health. Let's start with a story that might resonate with many of you. John, a vibrant 65-year-old retiree, had always prided himself on his active lifestyle and close relationship with his wife of 40 years. However, over the past few months, he noticed changes in his body that left him feeling confused and anxious. Intimate moments with his wife became a source of stress rather than joy. John felt alone and embarrassed, unsure of where to turn or how to address the issue. John's experience is far more common than you might think. In fact, according to recent studies, about 50% of men over the age of 60 experience some degree of erectile dysfunction. That's 1 in every 2 men. These statistics highlight an important truth. If you're going through this, you are not alone, and there's absolutely no reason to feel ashamed. Erectile dysfunction, often referred to as ED, is not a reflection of your masculinity or your worth as a partner. It's a health condition that can be influenced by various factors, many of which are a natural part of aging. Today, we're going to explore this topic in depth, providing you with valuable information and practical strategies to help you navigate this challenge. Before we dive deeper, it's crucial to understand the basics of how erections work. An erection is a complex process involving your brain, hormones, emotions, nerves, muscles, and blood vessels. It starts in the brain with sexual thoughts or sensory stimulation. This triggers a series of physical events, beginning with the relaxation of smooth muscles in the penis. As these muscles relax, blood flow increases, filling 2 chambers in the penis called the corpora cavernosa. As the chambers fill with blood, the penis becomes rigid, resulting in an erection. Understanding this process helps us recognize that erectile function can be influenced by a wide range of factors, both physical and psychological. It's not simply a matter of desire or willpower. Various health conditions, medications, lifestyle, factors, and emotional states can all play a role in erectile function. Now let's explore some of the common physical causes of erectile dysfunction. Cardiovascular issues are often at the top of the list. Conditions like high blood pressure, high cholesterol, and atherosclerosis can all impact blood flow, which is crucial for achieving and maintaining an erection. Diabetes is another significant factor, as it can damage blood vessels and nerves over time. Other physical causes may include hormonal imbalances, particularly low testosterone levels, which tend to decrease as we age. Neurological disorders, such as Parkinson's disease or multiple sclerosis, can also interfere with the nerve signals necessary for an erection. Certain medications, particularly those used to treat high blood pressure, depression, or prostate conditions, may have erectile dysfunction as a side effect. Lifestyle factors play a significant role too. Smoking, excessive alcohol consumption, and lack of physical activity can all contribute to erectile difficulties. Being overweight or obese can also increase your risk, as it's often associated with cardiovascular issues and hormonal imbalances. It's important to note that while these physical factors are common, they're not inevitable consequences of aging. Many can be managed or even reversed with proper care and lifestyle changes. This is why regular checkups and open communication with your healthcare provider are so important. Now, let's turn our attention to the psychological and emotional factors that can contribute to erectile dysfunction. Stress and anxiety are major culprits. In our fast-paced world, many of us carry significant stress from work, financial concerns, or family responsibilities. This stress can interfere with sexual function by disrupting the signals between the brain and the body. Depression is another common factor. It can lower libido and impact overall sexual function. Sometimes the medications used to treat depression can also contribute to erectile difficulties, creating a challenging situation that requires careful management with a healthcare provider. Relationship issues can also play a role. Unresolved conflicts, poor communication, or a lack of emotional intimacy with your partner can all impact sexual function. It's important to remember that sexuality is as much about emotional connection as it is about physical function. One of the most insidious psychological factors is performance anxiety. This often starts with a single instance of erectile difficulty, perhaps due to stress or fatigue. However, the worry about it happening again can create a cycle of anxiety that makes future erections more difficult. This is why it's so important to break this cycle early and not let one-off incidents damage your confidence. Self-esteem and body image issues can also contribute to erectile dysfunction, especially as we age and our bodies change. It's crucial to cultivate a positive self-image and remember that attractiveness and sexuality don't diminish with age. They simply evolve. Understanding these psychological factors is the first step in addressing them. Many men find that simply acknowledging these issues and discussing them openly with their partner or a healthcare professional can provide significant relief. Speaking of healthcare professionals, it's important to know when to seek help. If you're experiencing persistent difficulties with erections, it's always a good idea to consult with your doctor. They can help determine if there are underlying health issues that need to be addressed and discuss treatment options with you. Remember, seeking help is a sign of strength, not weakness. It shows that you're taking control of your health and prioritizing your well-being and your relationship. Your doctor has likely helped many men with similar concerns and can provide valuable guidance and support. In our next segment, we'll discuss some immediate strategies you can use to manage erectile difficulties, as well as long-term lifestyle changes that can improve your overall sexual health. We'll also explore how to communicate effectively with your partner about these issues and ways to maintain intimacy even when intercourse is challenging. Remember, you're not alone in this journey. Millions of men and their partners navigate these changes successfully every day. With the right information, support, and approach, you can too. Stay tuned for more practical advice and strategies in our upcoming segments. And before we move on, I'd like to remind you that if you're finding this information helpful, please consider subscribing to our channel. Your support helps us continue providing valuable health information to our community. Now, let's continue our discussion on managing and improving erectile function. Now that we've covered the basics of erectile dysfunction and its causes, let's dive into some practical strategies you can use right away to manage this condition. Remember, these are not just quick fixes, but tools to help you navigate intimate moments with more confidence and less stress. First and foremost, let's talk about the power of mindfulness and relaxation techniques. When you find yourself in an intimate situation and anxiety starts to creep in, try this simple breathing exercise. Close your eyes and take a deep breath in through your nose for a count of 4. Hold it for a count of 4, then exhale slowly through your mouth for a count of 6. Repeat this cycle a few times. This technique, known as box breathing, can help calm your nervous system and reduce anxiety in the moment. Another immediate strategy is to shift your focus away from performance and toward sensation and connection. Instead of worrying about achieving or maintaining an erection, try to immerse yourself in the physical sensations you're experiencing. Focus on the touch, the warmth, the closeness with your partner. This shift in attention can often relieve the pressure and allow your body to respond more naturally. Communication with your partner is crucial during these moments. If you're feeling anxious or experiencing difficulties, it's okay to express that. You might say something like, "I'm feeling a bit nervous, but I still want to be close to you. Can we take things slow?" This kind of open communication can not only alleviate your stress, but also deepen your emotional connection with your partner. Remember, intimacy doesn't always have to lead to intercourse. There are many ways to express affection and experience pleasure together. Explore different forms of touch, try massage, or focus on other aspects of foreplay. The goal is to maintain a sense of closeness and intimacy regardless of whether an erection occurs. Now, let's look at some longer-term strategies that can improve your overall sexual health and potentially reduce instances of erectile dysfunction. One of the most effective approaches is to focus on your cardiovascular health. After all, good blood flow is essential for healthy erections. Regular exercise, particularly aerobic activities like brisk walking, swimming, or cycling, can significantly improve cardiovascular health. Aim for at least 150 minutes of moderate intensity exercise per week. This doesn't mean you need to start training for a marathon. Even a 30-minute walk 5 days a week can make a big difference. Not only will this improve blood flow, but it can also boost your energy levels, reduce stress, and improve your overall mood. In addition to cardiovascular exercise, strength training can be beneficial. Exercises that target the pelvic floor muscles, often called Kegel exercises, can be particularly helpful for erectile function. To do a Kegel exercise, imagine you're trying to stop the flow of urine midstream. The muscles you use to do this are your pelvic floor muscles. Try tightening these muscles for 3 seconds, then relaxing for 3 seconds. Aim to do 3 sets of 10 repetitions each day. Diet also plays a crucial role in sexual health. A heart-healthy diet is generally a penis-healthy diet too. Focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. Foods rich in flavonoids, like berries, citrus fruits, and red wine, in moderation, have been associated with a reduced risk of erectile dysfunction. Omega-3 fatty acids, found in fish like salmon and sardines, can improve cardiovascular health and potentially benefit erectile function. It's also important to limit foods that can negatively impact your sexual health. Reduce your intake of processed foods, saturated fats, and added sugars. These foods can contribute to obesity and cardiovascular problems, which are risk factors for erectile dysfunction. Also, while moderate alcohol consumption isn't usually a problem, excessive drinking can impair sexual function, so it's best to drink in moderation. Quitting smoking is another crucial step if you're a smoker. Smoking damages blood vessels and can impair blood flow to the penis. If you're finding it difficult to quit, talk to your healthcare provider about smoking cessation programs or medications that might help. Stress management is another key component of improving sexual health. Chronic stress can interfere with hormone levels and contribute to erectile difficulties. Find stress reduction techniques that work for you. This might include regular exercise, meditation, yoga, or engaging in hobbies you enjoy. Even setting aside a few minutes each day for deep breathing or mindfulness exercises can make a significant difference. Getting enough quality sleep is also crucial for sexual health. Poor sleep can lower testosterone levels and increase stress hormones, both of which can contribute to erectile dysfunction. Aim for 7 to 9 hours of sleep per night. If you're having trouble sleeping, try establishing a regular sleep schedule, creating a relaxing bedtime routine, and avoiding screens for at least an hour before bed. Now, let's talk about the importance of overall health maintenance. Regular checkups with your healthcare provider are essential. Many health conditions that contribute to erectile dysfunction, like high blood pressure or diabetes, often don't have noticeable symptoms in their early stages. Regular checkups can catch these issues early when they're easier to manage. If you're on any medications, it's worth discussing their potential side effects with your doctor. Some medications, particularly those for blood pressure, depression, or prostate issues, can contribute to erectile difficulties. Never stop taking a prescribed medication without consulting your doctor first, but do have an open conversation about potential alternatives if you think a medication might be affecting your sexual function. Hormone levels, particularly testosterone, play a significant role in sexual function. As men age, testosterone levels naturally decline. If you're experiencing symptoms of low testosterone along with erectile difficulties, your doctor might recommend testing your hormone levels. In some cases, hormone replacement therapy might be beneficial, but this is a decision that should be made carefully with your healthcare provider, weighing the potential benefits and risks. It's also worth mentioning the potential benefits of pelvic floor physical therapy. While often associated with women's health, pelvic floor therapy can be beneficial for men too, particularly those experiencing erectile dysfunction. A pelvic floor physical therapist can teach you exercises to strengthen the muscles that play a role in erectile function and provide other techniques to improve sexual health. Remember, improving your sexual health is a journey, not a quick fix. Be patient with yourself and celebrate small improvements along the way. Every positive change you make, whether it's going for a daily walk, eating more vegetables, or practicing stress reduction techniques, is a step in the right direction. In our next segment, we'll discuss the importance of emotional and mental health in managing erectile dysfunction. We'll explore strategies for maintaining a positive self-image, nurturing your relationship, and redefining sexuality as you age. We'll also talk about when and how to seek professional help if you need additional support. Remember, you're not alone in this journey. Millions of men successfully navigate these changes every day. And with the right approach and support, you can too. Stay tuned for more practical advice and strategies in our upcoming segments. And once again, if you're finding this information helpful, please consider subscribing to our channel. Your support allows us to continue providing valuable health information to our community. Now, let's move on to our next topic: the emotional and mental aspects of managing erectile dysfunction. As we continue our discussion on erectile dysfunction, it's crucial to address the emotional and mental aspects of this condition. The impact of erectile difficulties goes far beyond the physical realm. It can significantly affect a man's self-esteem, relationships, and overall quality of life. Let's start by acknowledging that it's completely normal to feel a range of emotions when dealing with erectile dysfunction. You might experience frustration, anxiety, sadness, or even anger. These feelings are valid, and it's important not to suppress them. Instead, we need to find healthy ways to process and manage these emotions. One of the most powerful tools at your disposal is self-compassion. It's easy to fall into a pattern of negative self-talk when facing sexual difficulties. You might find yourself thinking, "I'm less of a man," or "I'm letting my partner down." However, it's crucial to challenge these thoughts. Remember, erectile dysfunction is a health condition, not a reflection of your masculinity or worth as a partner. Practice treating yourself with the same kindness and understanding you would offer a good friend facing a similar situation. Instead of harsh self-criticism, try supportive self-talk. For example, you might say to yourself, "This is a challenging situation, but I'm doing my best to address it. I'm more than just my sexual performance." Maintaining a positive body image is another important aspect of emotional well-being. As we age, our bodies naturally change, and it's easy to become self-conscious about these changes. However, it's important to remember that attractiveness and sexuality aren't limited to youthful ideals. Embrace the body you have now, focusing on what it can do rather than how it looks. Engage in activities that make you feel good in your body, whether that's dancing, swimming, or simply taking a leisurely walk in nature. Now, let's talk about the impact of erectile dysfunction on relationships. Open, honest communication with your partner is absolutely crucial. Many men feel embarrassed or ashamed to discuss erectile difficulties with their partners, but keeping silent often leads to misunderstandings and increased stress. Your partner may be wondering if they're no longer attractive to you or if they're doing something wrong. By openly discussing the situation, you can alleviate these concerns and work together as a team to navigate this challenge. Remember, erectile dysfunction is a couple's issue, not just an individual one. When having this conversation with your partner, choose a time when you're both relaxed and not in the middle of an intimate moment. Be honest about what you're experiencing and how you feel about it. You might say something like, "I've been experiencing some difficulties with erections lately, and I'm feeling anxious about it. I want you to know it's not because I'm not attracted to you. I'd like us to work through this together." Listen to your partner's feelings and concerns as well. They may be experiencing their own range of emotions about the situation. By openly sharing your experiences and feelings, you can strengthen your emotional intimacy, which is a crucial component of a satisfying relationship. It's also important to redefine intimacy and sexuality in your relationship. Penetrative sex is just one form of sexual expression. There are many other ways to experience pleasure and maintain physical closeness. Explore different forms of touch, try sensate focus exercises, or engage in other intimate activities that don't rely on an erection. This can help take the pressure off performance and allow you both to enjoy physical intimacy without stress. If you're single and dealing with erectile dysfunction, you might feel anxious about dating or starting new relationships. Remember, that honesty is the best policy. When you feel comfortable with a new partner, it's okay to have a conversation about your sexual health. Many people will appreciate your openness and be willing to work with you to find mutually satisfying ways of being intimate. Now let's discuss the importance of mental health in managing erectile dysfunction. Conditions like depression and anxiety can both contribute to and result from erectile difficulties, creating a challenging cycle. If you're experiencing symptoms of depression, such as persistent sadness, loss of interest in activities, or changes in sleep or appetite, or anxiety, such as excessive worry, restlessness, or panic attacks, it's crucial to seek professional help. A mental health professional, such as a psychologist or psychiatrist, can provide valuable support and treatment. Cognitive behavioral therapy, CBT, has been shown to be particularly effective in managing the psychological aspects of erectile dysfunction. CBT can help you identify and change negative thought patterns and develop coping strategies for performance anxiety. In some cases, couples therapy might be beneficial. A couples therapist can help you and your partner improve communication, work through any relationship issues that might be contributing to sexual difficulties, and develop strategies for maintaining intimacy and connection. It's also worth exploring mindfulness and meditation practices. These techniques can help reduce stress and anxiety, improve your ability to stay present in the moment, and enhance your overall sense of well-being. There are many apps and online resources available that can guide you through mindfulness exercises. Even just a few minutes of mindfulness practice each day can make a significant difference. Remember, seeking help is a sign of strength, not weakness. It shows that you're committed to your health and your relationships. Many men find that talking to a therapist or counselor provides relief and new perspectives on managing erectile dysfunction. As we age, it's natural for our sexuality to evolve. This doesn't mean it diminishes. Rather, it transforms. Many older adults report having deeply satisfying sex lives, often citing greater emotional intimacy and a better understanding of their own and their partner's needs. Embrace this evolution of your sexuality. Focus on the whole experience of intimacy rather than just the physical act of intercourse. In our next segment, we'll discuss the various treatment options available for erectile dysfunction, including medications, devices, and surgical options. We'll also explore some alternative and complementary therapies that some men find helpful. Remember, there are many effective treatments available, and with the right approach, most men can find a solution that works for them. As always, if you're finding this information helpful, please consider subscribing to our channel. Your support helps us continue providing valuable health information to our community. Stay tuned for more practical advice and information in our upcoming segments. Now that we've discussed the emotional and psychological aspects of erectile dysfunction, let's explore the various treatment options available. It's important to remember that erectile dysfunction is a treatable condition, and most men can find a solution that works for them. Always consult with a healthcare provider before starting any new treatment, as they can help determine the most appropriate option based on your individual health needs and circumstances. Let's start with one of the most well-known treatments: oral medications. Phosphodiesterase type 5, PDE5, inhibitors are the first-line treatment for many men with erectile dysfunction. These include medications such as sildenafil, Viagra, Tadalafil, Cialis, Vardenafil, Levitra, and Avanafil, Stendra. These medications work by enhancing the effects of nitric oxide, a natural chemical your body produces that relaxes muscles in the penis. This increases blood flow and allows you to get an erection in response to sexual stimulation. It's important to note that these medications don't automatically cause an erection. Sexual stimulation is still necessary. They also don't increase sexual desire. If you have no interest in sex, these medications won't change that. PDE5 inhibitors are generally safe for most men, but they can have side effects and may interact with other medications. They're also not suitable for everyone, particularly men with certain heart conditions or those taking nitrate medications. If oral medications aren't effective or appropriate for you, there are other options to consider. One such option is alprostadil, which can be administered in two ways: as an injection into the penis or as a suppository placed in the urethra. While the idea of an injection might sound intimidating, many men find that it's not as uncomfortable as they feared, and it can be highly effective. Another treatment option is vacuum erection devices. These are external pumps that create a vacuum around the penis, pulling blood into it. A tension ring is then placed at the base of the penis to maintain the erection. This can be an effective option for many men, particularly those who can't take or don't respond to oral medications. For men with low testosterone levels, testosterone replacement therapy might be recommended. This can be administered through gels, patches, or injections. However, it's important to note that testosterone therapy is only appropriate for men with clinically low testosterone levels, and it carries its own risks and potential side effects. In some cases, particularly when erectile dysfunction is caused by specific medical conditions, surgery might be an option. Penile implants, for instance, can be surgically placed inside the penis. These implants allow you to control when and how long you have an erection. While this is typically considered a last resort, many men report high satisfaction rates with this treatment. It's worth mentioning that for many men, a combination of treatments might be most effective. For example, using oral medication along with lifestyle changes and therapy can often yield better results than medication alone. Now, let's explore some complementary and alternative approaches that some men find helpful. While these methods may not have as much scientific evidence behind them as traditional medical treatments, some individuals report benefits from their use. Acupuncture, an ancient Chinese healing practice, has been studied for its potential effects on erectile dysfunction. While more research is needed, some studies suggest it might be helpful for some men, particularly when erectile dysfunction is caused by psychological factors like stress. Certain herbal supplements, such as ginseng, L-arginine, and yohimbine, have been touted for their potential benefits in treating erectile dysfunction. However, it's crucial to approach these with caution. Herbal supplements can interact with other medications and may have side effects. Always consult with your healthcare provider before starting any new supplement regimen. Pelvic floor exercises, also known as Kegel exercises, can be beneficial for some men with erectile dysfunction. These exercises strengthen the muscles that help hold blood in the penis during an erection. A pelvic floor physical therapist can teach you how to perform these exercises correctly for maximum benefit. Some men have found success with lifestyle changes alone. This includes maintaining a healthy diet, regular exercise, stress reduction techniques, and limiting alcohol consumption. While these changes might not be enough to completely resolve erectile dysfunction for everyone, they can certainly contribute to better overall health and potentially improve erectile function. It's also worth considering the impact of certain medications on erectile function. Some medications, particularly those for high blood pressure, depression, or prostate conditions, can contribute to erectile difficulties. If you suspect your medication might be affecting your sexual function, talk to your doctor. Never stop taking a prescribed medication without consulting your healthcare provider first, but they may be able to adjust your dosage or switch you to a different medication. with fewer sexual side effects. Remember, finding the right treatment often involves some trial and error. What works for one person may not work for another. It's important to be patient with the process and maintain open communication with your healthcare provider. If one treatment doesn't work, don't be discouraged. There are many options available, and most men can find an effective solution. It's also crucial to address any underlying health conditions that might be contributing to erectile dysfunction. Conditions like diabetes, high blood pressure, and high cholesterol can all impact erectile function. Managing these conditions effectively can often lead to improvements in sexual function. Psychological therapy can be an important component of treatment, either on its own or in combination with other treatments. Cognitive behavioral therapy, in particular, can be effective in addressing performance anxiety and other psychological factors that contribute to erectile dysfunction. For some men, a few sessions with a therapist can make a significant difference. Couples therapy can also be beneficial, especially if erectile dysfunction is causing strain in your relationship. A therapist can help you and your partner improve communication, explore new ways of being intimate, and work through any relationship issues that might be contributing to sexual difficulties. As we near the end of our discussion, it's important to emphasize that seeking help for erectile dysfunction is a sign of strength, not weakness. It shows that you're taking control of your health and prioritizing your well-being and your relationships. Remember, erectile dysfunction is a common and treatable condition. You're not alone in this experience, and there's no need to suffer in silence. In our final segment, we'll recap the key points we've covered and provide some additional resources for further information and support. We'll also discuss how to talk to your doctor about erectile dysfunction and what to expect during a medical consultation. Before we move on, I want to remind you once again of the importance of overall health in managing erectile dysfunction. Regular exercise, a healthy diet, stress management, and good sleep habits can all contribute to better erectile function and improved overall well-being. These lifestyle factors are within your control and can make a significant difference in your sexual health and quality of life. Stay tuned for our concluding segment, where we'll bring everything together and provide you with actionable steps to move forward. Remember, with the right information, support, and treatment, you can effectively manage erectile dysfunction and maintain a satisfying sex life at any age. As we come to the conclusion of our discussion on erectile dysfunction, let's take a moment to recap the key points we've covered and provide you with some final thoughts and resources to help you move forward. We began by emphasizing that erectile dysfunction is a common condition, affecting millions of men worldwide, particularly as they age. It's crucial to remember that you're not alone in this experience, and there's absolutely no shame in seeking help. Erectile dysfunction is a medical condition, not a reflection of your masculinity or worth as a partner. We discussed the various causes of erectile dysfunction, both physical and psychological. Physical causes can include cardiovascular issues, diabetes, hormonal imbalances, and neurological disorders. Psychological factors like stress, anxiety, depression, and relationship issues can also play a significant role. Often, it's a combination of physical and psychological factors that contribute to erectile difficulties. We explored the importance of lifestyle changes in managing erectile dysfunction. Regular exercise, particularly aerobic activities and strength training, can improve cardiovascular health and potentially benefit erectile function. A healthy diet rich in fruits, vegetables, whole grains, and lean proteins can also make a difference. We emphasize the importance of limiting alcohol, quitting smoking, and managing stress through techniques like mindfulness and meditation. We delved into the emotional and psychological impact of erectile dysfunction, highlighting the importance of self-compassion and maintaining a positive body image. We discussed strategies for communicating openly with your partner and redefining intimacy in your relationship. Remember, intimacy is about more than just sexual intercourse. It's about emotional connection, trust, and mutual understanding. We then explored the various treatment options available, From oral medications like PDE5 inhibitors to more advanced treatments like injections, vacuum devices, and surgical implants. We also touched on alternative therapies and the potential benefits of pelvic floor exercises. The key takeaway is that there are many effective treatments available, and with patience and the guidance of a healthcare professional, most men can find a solution that works for them. Now, let's discuss how to approach a conversation with your doctor about erectile dysfunction. It's natural to feel uncomfortable or embarrassed, but remember that healthcare providers are trained professionals who have likely helped many men with similar concerns. Here are some tips for your medical consultation. 1. Be honest and direct. Your doctor needs accurate information to provide the best care. 2. Prepare a list of your symptoms, including how long you've been experiencing them and any patterns you've noticed. 3. Bring a list of all medications you're taking, including over-the-counter drugs and supplements. 4. Don't hesitate to ask questions. If you don't understand something, ask for clarification. 5. Discuss your treatment preferences and any concerns you have about potential side effects. 6. If you're comfortable, consider bringing your partner to the appointment. They can provide support and additional information. Your doctor may perform a physical exam and order blood tests to check for underlying health conditions. They might also refer you to a specialist, such as a urologist or endocrinologist, for further evaluation. As we wrap up, I want to emphasize that managing erectile dysfunction is a journey. It may take time to find the right solution, and there may be setbacks along the way. Be patient with yourself and celebrate small improvements. Remember that your worth is not defined by your sexual performance, and a fulfilling life encompasses much more than just sexual activity. That being said, sexual health is an important part of overall well-being, and you deserve to have a satisfying sex life at any age. Don't hesitate to seek help if you're experiencing difficulties. With the right support and treatment, most men can effectively manage erectile dysfunction and maintain intimate, satisfying relationships. Here are some additional resources you might find helpful. 1. The American Urological Association, www.uanet.org, provides comprehensive information about erectile dysfunction and other urological conditions. 2. The National Institute of Diabetes and Digestive and Kidney Diseases, www.nidknich.gov, offers detailed, research-based information on erectile dysfunction. 3. The Sexual Medicine Society of North America, www.smsna.org, provides resources for both patients and healthcare providers. 4. Support groups, either in person or online, can provide a space to share experiences and coping strategies with others facing similar challenges. Remember, erectile dysfunction is a health condition, not a personal failing. By taking proactive steps to address it, you're demonstrating strength, self-care, and a commitment to your overall well-being and your relationships. As we conclude, I want to thank you for joining us for this important discussion. By educating yourself about erectile dysfunction, you're taking a crucial step towards better health and a more satisfying life. Remember, knowledge is power, and you have the power to take control of your sexual health. If you found this information helpful, please consider subscribing to our channel. Your support allows us to continue providing valuable health information to our community. Don't forget to like and share this video with others who might benefit from this information. Remember, you're not alone in this journey. With the right information, support, and treatment, you can effectively manage erectile dysfunction and maintain a fulfilling, intimate life at any age. Here's to your health, happiness, and well-being. Thank you for watching and take care.